Hey guys, I want to show y'all a little something here. Here is my McNab and Border Collie, and you see what she's trying to do right now? She is trying to lick a spot that she got ripped open on her side. Don't gross out. Um, she has cut herself on a piece of metal, and we're going to do something here to show you how, in an emergency, you can fix your animal, fix your pet. Now, this is about a 3/4 by 1/2 inch gash that she has in her skin. I have cleaned the hair away from it to get access, and we have flushed it out. And the problem with Anna is you just seen her starting out. She wants to lick that spot and she can barely reach it. And if you're in an emergency situation, you probably have one of these, which is a little tub like you would get for ice cream or potato salad or something. And you have to find a way to keep them from aggravating the injury that they have. You've seen the large dog collars that they put out for this to prevent them from hurting themselves like a big funnel. Now, this here is going to have to be super glued shut. So let me grab the super glue and I'm going to show you how, in this situation, even on a person, this actually can help them heal. Now, it's flushed out, and super glue is very, very sterile. It also sterilizes when it's used. It has an acetate in it. So she's not in any pain. She's aggravated, and it does look very gnarly, but it's not as bad as you actually think. Animals can handle this more than you think. So let me get that, and we'll do the repair on it. Okay, now one of the things you're going to want to do is you're going to take a razor knife and cut the bottom out of the bowl that you have. Make sure the bowl is sufficient to where when you cinch it up and it goes around the animal's neck, that it will keep them from bending their neck to touch the injury that they have. Okay, now I've kind of prepped everything and got it ready. Now we have help over here, and you can see it's not a very nice one. I'm going to show you this. Don't let you gross yourself out. But it's a pretty gnarly little cut, and you want to make sure you get the hair cleaned away there pretty good. And the one thing that I use will be this stuff here. It's just these little packets that you can get with the auto puncture cap on it. They're disposable and they're sterile. Now, I've taken this ring here and I've test fitted on her so that I can get it around her neck. And the reason you have to do this is they will open the cuts back up. And this one's made like this, so it'll go around her neck and she can't spin it, and it can't go past her ears, so that it stays on her neck. And you want to put it on fairly tight so that they can't bend their head, and you still want to watch them though. All right, so using a knife, cut the bottom out, test fit it, get the glue ready, get the tape ready, because you're going to tape up everything. Now in this case here, we have to dry the injury out because it's been cleaned, and we're going to dry it out. Get it very dry, and that is a bad looking one. You want to make sure all hair is out of the way. So I'm going to be taking the skin of it right here and make sure it stays dry and debris free. Get anything and everything out that you can. And in Anna Mae's case, she's a little aggressive about wanting to tear this stuff open. And I use hydrogen peroxide to do a firm cleaning. And then you're going to get it close to itself, the cut or the injury, and you're going to just basically feed it to it with the super glue. Now, super glue is a common surgical tool now, and you're going to take it and wipe it down in the cut. Blow a little air on it. Now you notice I'm leaving a spot open here in the back, right here in the back where the cut's at. This is shaped like a piece of angle iron, and apparently she cut herself on a piece of steel. Now watch, I let go. Now I'm going to take this section here. You want to leave it just enough to where you can walk any liquid or fluid out, or anything that might be trapped in it. It'll flush it out. And then I'm going to put, now you notice Anna Mae's pretty patient for basically a 13-year-old puppy, so. And then I'm going to push it together like so, and I'll use the end of that Blow a little air on it. You want it to dry quickly. And once you're done, you're going to take and daub a little wet super glue over the entire surface of the injury. Now, what's going to happen is the skin's going to grow in from underneath and it will start the healing process. Now, veterinarians will also use this same technique, and they'll use a more commercial grade collar than what I'm going to use, but this is happening on a weekend. We can't get a hold to anybody, and I have worked with a lot of veterinarians in my past. So you want to move it around, make sure that it did not glue to the inner flesh, which it did not. If it did, you just keep moving it around, the skin itself will come loose from it. And then dab a little more glue on it. I want you to see how very patient Anna is. And she's fine. She's pissy, but she's fine. So there is the injury in repair. This is how I've learned how to do it on cattle that's cut themselves open, and horses, and it prevents flies until the skin hardens up enough to have its own defenses. And Anna Mae's ready for her makeshift collar, so let me get that on her right quick. Okay, now I've got a girl that don't like the fact that she's got a collar on her, but she has a repair done that she can't turn her head to disrupt or open back up again. And look at her. Anna Mae, 13 years old. Come here. She don't like it at all, but she's fixed. On a weekend with no veterinarian you can get hold to, this is how you fix it. This is how you fix it. She wants that off of her so bad. But it's to prevent her from opening it back up, even though she can barely reach it. And if you have an injury like back here somewhere, well, they'll still be able to reach it because they can twist it enough. So you want to use one that's longer, and maybe even put you some kind of a dog collar threaded through it. Shape it how you need to immobilize without choking them. I can still put my fingers in there just fine, without causing them any problems. And that way you don't have to have an issue with her or him causing an opening when you're not watching them, because they'll want to do that. It's going to itch, it's going to bother them, and they're going to do that. But in her case, she is shaved, patched, glued, and secured. Right, Anna? Yeah, pitiful. All right, guys, stuff you have around the house.